Hello everyone, I am Dr. Ashish Mohite. I have done my graduation from JJ Hospital Mumbai, followed by my MD Nuclear Medicine from Tata Memorial Hospital Mumbai. I have spent my 5 years in the prestigious Tata Hospital Mumbai, took experience from there, following which I have joined Cancer Centers of America, Nashik. So let's understand how this procedure is done of PET-CT. Most of the times the radiopharmaceutical or the medicines which we need for PET-CT scan is procured from a city or metropolitan cities such as Mumbai or Delhi, and so that's the reason the transportation and everything has to be taken into consideration. It can result in a delay of the medicine reaching the hospital by half an hour or 1 hour, or most of the times although it reaches on time, but there could be a variability, so that has to be taken into consideration. Once the medicine arrives into the hospital and the patient has also visited the hospital, so the patient will be asked if they have any history of contrast allergy, a consent, a proper consent explaining them everything, how the scan is being done, what are the side effects, or will there any be untoward effect that would happen to the patient. Those are being explained to them. A consent is being acquired from the patient, and then we do the blood test. The blood test we do to evaluate how much the blood glucose level is within the patient. Ideally we need blood glucose level less than 180 milligram per deciliter. If it is greater than that, then we'll have to reschedule the patient, or we'll have to evaluate what are the reasons the patient blood glucose is uncontrolled. We do this just to assure that our FDG medicine gets distributed adequately. So after we have checked the blood glucose level, after we have taken the consent from the patient comes inside the laboratory, and there we secure an IV line, a good bore IV line, where the contrast could be easily injected to the patient, and even the FDG. Now the FDG or our radioactive substance is injected to the patient, and after the injection there is a waiting period of almost 45 to 60 minutes. Now why is this? It's because FDG, as a regular glucose also, it requires that much of time to distribute within the body, within the physiological size, the normal organs, and in the tumor foci. After this waiting period of 45 to 60 minutes, then we take the patient for scanning. Depending on the machine, the quality, or the electronic configurations of the machine, the time could vary for acquisition of the scan, but it is usually around 15 to 25 minutes. So that is the time period when the scan is being acquired. After the scan is acquired, we check the scan whether it has been acquired properly, if the patient has done any motion. Now some patients who are in lots of pain or who have breathing difficulty, they might have certain amount of motion, and to correct this we might have to reacquire certain part of the scan. So once we check the scan, if it is perfect, the patient is then advised just to wait for half an hour to check if there is any delayed contrast reaction. If there is no such reaction, if the scan is being perfectly acquired, then the patient can be asked to go home. So all in all, this procedure, starting from the medicine coming into the hospital, the variability of that, followed by administration of the injection, followed by acquisition of the scan, and then checking of the scan, this overall takes around 2 to 3 hours. In rarer condition it could go to 4 hours. In idealistic condition it would get over to 2 hours. So whenever the patient comes, we recommend them the period will be from 2 to 4 hours, and they have to be prepared for that much. So there are no great precautions that are to be taken after the PET-CT scan, because unlike other radiopharmaceuticals which could be used in SPECT-CT or in therapy, the PET-CT medications, they have very low energy, very low penetration, which means it is very suitable, and the half-life, the time required for the medicine to get excreted from the body or to decay from the body is also less, approximately 2 hours or less than 2 hours. So it becomes very safe. The patient can even sit in a crowded places after the scan. That's all perfectly alright when we talk about PET-CT and when we are using a conventional radiopharmaceutical such as 18F FDG. Only precautions are taken when the patient's creatinine is borderline and still a contrast has been administered for better characterization. In those conditions, we recommend excess of hydration, rather double the hydration of what the patient consumes, and the patient is supposed to go frequently for urination to excrete the contrast agent, and even the FDG could be excreted easily. So those are only the precautions that are to be taken in a conventional and regular patient. It little varies. If the patient is a female patient and is a breastfeeding, then we ask the patient to not feed the breast milk to the baby for 12 hours approximately, and prior to this only the scanning and everything, we ask them to have express milk, and that can be fed to the child. Those are only the precautions, very minimalistic.